everyone, and welcome. My name is Meredith Klett, and I'm the Executive Director for Oregon and Southwest Washington with the American Heart Association. It's my pleasure to welcome guests from across Oregon to the American Heart Association's Community Conversation about community clinical linkages, sponsored by Cambia Health Foundation, Corporate Foundation, Regents, Blue Cross Blue Shield Health Plans. We're so excited to have you join us. Before we start, just a note for our audience. You'll notice a Q&A icon in your menu. This is where we want your questions. Drop questions in the Q&A, and if we don't cover it, we will follow up in an email. You can also feel free to comment and stay engaged through typing in the chat. And because this is a webinar, you don't need to worry about the mute or unmute, sharing, or anything else. Sit back, relax, and enjoy. I'd like to now introduce you to our moderator and panelists today. Dr. Dorinda Schubert, a licensed psychologist, leads Bridge Meadows as the executive director. She advocates nationally for intergenerational housing, solutions to complex social challenges, spearheads strategic planning, shaping Bridge Meadows' expansive vision for the future. Bridge Meadows creates and inspires intergenerational communities, enriching the well-being of children, families, and elders. Dr. Schubert has been honored for her contributions to housing, community development, and leadership. She speaks locally and nationally and at TEDx Mount Hood about the power of intergenerational solutions. Thank you for moderating this important conversation today, Dr. Schubert. Our first panelist is Carla Ficinich Pacheco. Carla is a health and wellness program manager at Adelante Mujeres Clínica Esperanza, where she oversees and supports Produce RX, Child Nutrition, and Promotores de Salud community health workers programs. Originally from the East Coast, Carla has quickly built meaningful relationships within the community, leading initiatives that focus on the health and well-being of Latinas and their families. She holds a master's degree in international development with a focus on nonprofit management. I'd like next to introduce and welcome Dr. Lynn Jacobs, who came to Virginia Garcia Memorial Health Center as a National Health Service Scholar after completing her 3-year residency in family medicine in Martinez, California. She chose this line of work because she has a strong sense of social justice and wanted to serve in a community that has been marginalized and had limited access to high-quality, culturally appropriate medical care. Along with other colleagues, Dr. Jacobs spearheaded the transformation of Virginia Garcia from a health clinic into a wellness center that includes access for patients and the community to a teaching kitchen, exercise classes, a community garden, and many other wellness activities. Thank you all for joining us to share your expertise today. Dr. Schubert, I'll turn it over to you.
Thank you so much, Meredith. So before we dive into the programmatic work of our guests here today, I would like to ask the two of you to share about your organizations, the populations you serve, and your missions.
It's interesting, as you announced, or as we gave the opening statement, I had pulled some things from our mission statement, but really Virginia Garcia was created almost 50 years ago today in response to a small child, Virginia Garcia, dying unnecessarily from a treatable illness. And our mission is to provide this high quality, comprehensive, and culturally appropriate healthcare for the communities here in Washington and Yamhill counties. We emphasize seasonal farm workers and migrants as our population, those that have barriers to healthcare, receiving high quality healthcare. We have 6 clinics, primary care clinics. We have 6 dental clinics. We have 5 school-based clinics, and we have a reproductive health center. We also have 2, almost 3 mobile outreach vans, and that's kind of us in a nutshell.
That is vast access and to health and well-being services. Thank you so much. And Carla, would you like to share?
Hi, yes, thank you. So Adelante Mujeres is a nonprofit organization in Washington County. We are, I think we've been around for now 20-something years, 21, 22 years. And our focus is working with Latina women and their families. And so we we focus on three things, and it's education, leadership, and enterprise opportunities for our Latina women and their families, and so that they can feel empowered and become strong leaders in our community. We have a ton of programs, and every year we continue to expand. We have lots of education programs, Chicas program, early education, and then we have the program that we're going to talk about today, the produce prescriptions, health and wellness. We recently, and actually tomorrow is going to be our ribbon cutting for our Clínica Esperanza. So it's a really amazing opportunity. We have now incorporated with all of our programs a mental health aspect and a trauma-informed way of running our program. So just a lot going on, really excited to be here. And that clinic is actually in Hillsborough. So we're spreading out a little further in the Washington County area.
Well, what a treat for all of us to hear from the both of you who are working in incredibly innovative and expansive organizations and very well respected. So thank you so much for being here. Okay, Carla, what is a produce prescription program? We have to say that slowly. Can you share with us how it functions between having a community-based organization partner with a clinic?
Yes. So I also need to slow down myself because I get really, really excited. And this is just one of my favorite topics. A produce prescription program is exactly what it sounds like. It is a doctor or physician that refers a patient, and in this case to a community-based organization, which is Adelante Mujeres, for a diet-related disease that they have been diagnosed with, which could be obesity, diabetes, high blood pressure, high cholesterol. And then the prescription is given to them to purchase fruits and vegetables. And so it can be at their local farmers market, it can be at local stores, working with the community, but it can also be at bigger retailers. And so they're only allowed to purchase fruits and vegetables. So what is this going to do? This is going to change their way of viewing food and hopefully help them with these diet-related diseases. So it's preventative care, but it's also support and guidance throughout this journey that they're on. And in our specific, so there's many different types of produce prescriptions, and I think the produce prescription world is trying to figure out what terminology we want to use and how we're going to approach this with all the changes that have been coming up recently with funding. But at Adelante and Virginia Garcia's program, we focus on our Latina community. So we are addressing health disparities. We've been working with Virginia Garcia for 10 years plus. And so what the beauty of it is their patients become our participants. And so we actually have all of our nutrition education classes in Virginia Garcia's building in Cornelius, Oregon. So it's pretty amazing, this partnership, right? They have a beautiful kitchen we're able to use. They share all this with us. And so we are very focused on that participant experience. There is a lot of background too. So in many years, maybe many people have heard that we used to give vouchers. But now with so much technology, we actually have debit cards or prepaid cards, as we call them. And we work with About Fresh, and the card is called Fresh Connect. And so they're able to actually swipe these cards, and they don't have that feeling of having to pull out all these vouchers and everyone sees them. No, they just use a card just like any other credit card, and they're able to purchase their fruits and vegetables without any issues, right? And then another important component of our produce prescription program is the education component. So we do use popular education. So it's just, we are in a circle. We are talking to them that they know a lot about nutrition too. So we're not just there to teach. We're there to listen. What is going on? What do you need from us? How can we work together to build something instead of shaming or instead of putting people down because of their diet-related illness? We also have something that I'm going to mention a lot today. So I think it's very important, is the community trust that we build. And that's how I think a produce prescription can become so impactful in a community. Is Virginia Garcia, as you heard from Dr. Lynn Jacobs, has been around for a long time, and so has Adelante. So we have this trust in the communities. They believe in us and what we're doing, And we look for the research, and I mean, we research as much as we can on nutrition and diet related diseases to give them this information so that they feel empowered to then continue on their journey for better health. And yeah, I think that's just a little bit, but I know we're going to have plenty of time to talk a little bit more about, but I think that tackles everything. I will say that each month our participants receive a monthly amount. So it's all dependent on how many people are in their home. So that's another great thing. A lot of Protus prescriptions programs might only give to the person who was diagnosed with the diet related disease, but no, we've actually had the opportunity to give to everyone in the family. So each person in the family receives $65 a month, depending. So if it's 4 family members, 5 family members, and then they have to use that within the month. And then the nutrition education classes are once a month. We divide them up into groups because we have about 50 participants, so we need to divide them up a little bit. And then they must join at least 80% of all of our classes. So that's where they're going to get tons of information, and not just on nutrition, on anything. We definitely have a lot more wraparound services, and not just focused on Protus prescription, but anything that they need and everything.
You know, how you describe the program, Carla, it's so dignified, and listening to the community for what they need, and that trust is so important. And then that holistic approach within the family. It's not just one person, it's everybody, so that everybody can come alongside this idea of eating healthy fruits and vegetables. And so just really quickly, where did this idea begin about making a Protus prescription program?
So I will let Dr. Jacobs. So it began 10 years ago. So it started in 2014. And I think Dr. Jacobs is going to have a lot more historical background on this. But it was, I can talk about a little bit the last couple of years that I've been a part of it. But I think it's just, from what I know, is that we saw the need. Our community was asking us for this. We were seeing a very high risk, not just in adults with diet-related diseases, but children. And so then I think that sparked, what can we do? How are we going to figure this out? How are we going to find funding? And then Dr. Jacobs, I'll let you continue.
Yeah.
And I think it started with a small little group, and now we've expanded so much.
So Dr. Jacobs, go right ahead.
Sure. I feel like it's hard to remember back exactly how this began, honestly. But I know that there was a federal grant that was being offered, and it included partnership as one of the founding principles. You had to have 2 or more organizations work together. And because, like I said, we've been in the community for almost 50 years. Adelante's been in the community for over 20. And so it was kind of a national partnership that they would come to us. We had gone to them in the past for another type of programming. Around that time, we were also piloting a program at our wellness center that included, it was called Reclamando Su Salud, or Reclaiming Your Health. And so we were doing something similar, but not really getting them necessarily the access to the vegetables. And so that opportunity to teach about health in a respectful fashion, in a culturally appropriate fashion, kind of taking into consideration the desires of the group that you were actually working with, very important, right? To listen to what people are needing and then modify what we're doing, and as far as topics that we're presenting on or facilitating conversations. All of those things are very important, I think, in both models, like the Reclamando Su Salud, listening to our participants, and then the Protus RX program. Really, how could you listen to what the community wanted? So the program started with a grant that funded about 10 families to get access to produce. And it wasn't families at that time. I don't believe that it started that way. I think it started out as the individual. And then over time, a couple of years, the produce, they were able to access funds through grants from our local health CCOs. So really that shift happened, I believe, when we were able to collaborate even further with the people that are providing their insurance, so they're like, this is actually really important. And we understand that it's not just the individual, it is the entire family at risk for, if they don't have the disease now, they may develop it in the future. And teaching about nutrition and having access to actually healthy vegetables and fruit is fundamental. And it's very different than giving out food stamps, right? You're giving out food stamps, people make choices, which is great. They make choices about their family's health and how to use that money. But if they're directed towards fruits and vegetables, they're given education around how to use those items in their daily meals, that becomes actionable, right? People will have access to those things.
And then how do you choose who goes into the program, Dr. Jacobs?
So that's been an evolution as well. And really what we want is they're patients of the Cornelius Clinic, where I am one of the site medical directors. And initially they came only from my panel, then my team, and now the whole site. They had to have at least one family member who had a chronic illness that was impacted by nutrition. They are not going to be receiving SNAP benefits because we didn't want to overlap so much. We wanted to provide it to families maybe that didn't have access to those funds. They needed to be committed to attending 12 monthly group visits. They need to attend, as Carla mentioned, at least 80% of those visits, so they can miss up to 3 sessions. They needed to be willing to go to the farmers market because what's really unique about our program, or the joint program, is that we encourage them to attend the farmers market in Forest Grove or in Cornelius, where they're going to use the majority of their monthly allotment there. During the months that the farmers market is not in function, they can use some of those local chain stores or stores that have agreed to partake in this program. But we really wanted them to get access to fresh, seasonal, locally grown vegetables, and that's where it happens, is at our farmers market. And we wanted them to be willing to work occasionally in our garden. That's been a new addition, and Carla and I can talk more about that, but we've had a community garden at Virginia Garcia for over 10 years. Our problem has been COVID, which everybody has gone through and continues to feel the effects of. And so this year we piloted a different type of project to try and get the Adelante Mujeres families involved in how our garden was growing. And then they also have to be able to attend some nutritional classes with our diabetes educator, who's a nurse, and that's a new addition this year as well.
What a well-rounded, you're so thoughtful in rounding it out and touching all these different points of people's lives. What have been the health benefits that you've seen in your participants?
Well, I know for one, they are eating better. And many of them are experiencing the benefits of, shifting their diet from a meat and grain vegetable diet to a whole vegetable diet. We've seen some blood pressure go down. We've seen cholesterol profiles be adjusted. We've seen weight loss be achieved, and overall family health. And I think that the mental health benefit is not, we haven't focused as much on how to quantify that, but I want to say that I know from just talking with my patient care coordinator about how connected those families feel to one another and to the community, to the clinic, to Adelante Mujeres. I think those connections have helped decrease loneliness and decrease mental health stress, which I think we're all experiencing as well.
So important, especially post-COVID, and our U.S. Surgeon General talking about how social isolation and loneliness is an epidemic in our country. And here you have found an antidote to do that, to take care of that. So I'm interested in, how long do participants stay in the program? Is there an end date, or how does that work?
I'll take this one.
Sure, Carla.
So we are also learning a lot about what makes sense and how long do you keep someone in a program, because you want to reach so many people, right? So we actually started this program with 3 years, and because we only were able to work with the farmers markets, so that meant farmers market season, which here in Oregon is from May until October. So that's why we ended up doing 3 years. But now with this Fresh Connect card that I had been speaking about, the prepaid card, we can work with our families all year round. And this has been a change since 2022. So we've decided with just a lot of decision making within the team that each participant will be in our program for 2 years. And I think that gives us enough time to do some evaluation with them, to talk to them, for them to also feel comfortable within the group, comfortable with us. And so that's what we've decided on.
Okay. So from both of you, what has been some feedback you've gotten from the participant? Dr. Jacobs?
I think they're very excited and they don't want it to end. I would say for a lot of my patients that I see, they're like, oh, can't I continue? I said, you can continue buying vegetables and fruit, and we want to support you doing that, and support you in getting continued education in our wellness center. But because of this, the limitations and trying to reach as many people as possible, we can't keep you in the group forever. But people just really enjoy the opportunity to meet with one another. They enjoy the opportunity to learn together and to share. I think there's so much empowerment that happens when you use this this model of care, where you're really coming from a community health worker and a promotora kind of viewpoint, where everybody has something to offer. I think people are feeling that, and I get that from my interactions with them. They feel very strongly that it is a place where they can share, learn, and be heard.
And I wanted to add that we do these evaluation surveys at the end of each year, not just the 2 years or 3 years that they're in the program. And so everything that they write down, we take seriously. And they had asked us, our participants and Virginia Garcia's patients, they want more time in the class. Because of COVID, we had actually done some virtual classrooms, but they were telling us, no, we want to be in person, we want to be together, we want to be in community. And so that was very important to us. They also asked us for exercise. So it's not just nutrition, it's how nutrition is connected to everything that we do in our lives, right? So exercise has been a really key point that we are now doing every single class, even if it's just a walk around the building for 15 minutes or Tai Chi or something that we want to incorporate. But movement is now in our classrooms. And we've also heard a little bit more about inviting the children to come and cook with us. And so we didn't realize, because it's mostly just the women of they're mostly mothers of the group. And so they were like, yeah, can we bring our children so that they can learn? They can also bring these tools back to the house. And so we've incorporated some classes with children. We also offer childcare. So if we need to focus on if it's going to be a really tough topic or a situation that we need just the parents, then we always have childcare as well. And then our participants have also asked us for other options of classes. So the majority of our participants need afternoon classes. And so we've been able to change some of them who need morning. We've been able to working with Virginia Garcia, dedicate some morning classes and some afternoon, late evening classes, so that they can attend the majority of their classes. So yeah, there's been a lot. I think the one thing that's really beautiful too is that it's something that I always want to, this isn't like a weight loss program. This isn't like, we're focused on helping them reach their goals, but also there's some personal goals. There's some things that are just like, I want to incorporate a new vegetable in my diet, little things that actually mean really big, important changes in their lives. So we take all of that into consideration, and it's not just, we don't need all these percentages to show. We also want to talk about their heart and their soul. And what Dr. Lin was saying too is like the mental health aspect. how are they feeling? Are they lonely? What do they need from us? So it's all related, and it's all related to nutrition and the food that we put into our bodies. But we've gotten a lot of really beautiful testimonies from our participants, and this is why I think we continue doing this work and we keep fighting for more funding.
Well, let's turn to what are the barriers you've experienced in managing the program and finding funding, and has there been any hiccups in the collaboration, and how have you managed those? You want to start, Carla, and then Dr. Jacobs, you follow up?
Yes, thank you. So, like everything, there's always some negative aspects, right? There's some difficulties and barriers, as we're going to say today. So there are some situations with funding, which I hope is going to change soon, but there are some funds that are restricted, and a lot of our funding, and we have some amazing funders, really amazing funders, Rockefeller, Care Oregon, American Heart Association. The thing is that sometimes it's very focused on servicing the community. So what about us, right? What about the people who are running the program? What about the childcare? What about the utilities for the kitchen that we're using at Virginia Garcia? There's all this other stuff going, or even capacity building, professional development, the importance of, we need to be up to date with what's going on in the nutrition world, right? And so where is the funding for that? It's kind of sometimes hard to find. But I think things are going to change in 2025. I think also what's important is expansion, right? So we don't want to continue just in the last 10 years only with 10 participants at a time. We want to expand. We want to get to more people, and we know that there is a need, but again, a little bit sometimes hard to show that need always, because we don't have the best data collection or evaluation. So as I had said before, we're using surveys that we made ourselves. We actually worked with a third party to help us. It was called Project Impact. So they've helped us learn how to survey our participants and also interview our participants, which was a great professional development moment for me and my team. But we need more, right? We need more data. We need more information, so that I think that's like what impacts our funders and wants them to get on board, and let's increase and expand this. Another thing that is a little challenging at times is technology. So we have all these really great, amazing platforms, but we need support to build them. And we need that time, dedication for that technology infrastructure that's not cheap and sometimes hard to streamline in a smaller community-based organization. So I would say that is definitely another barrier. And then I didn't even talk about the barriers that our participants face, right? So our participants sometimes don't always feel comfortable going to a farmer's market. Maybe they've never thought they could shop there, because sometimes the prices are, well, most of the time, and they're a little bit more because they're local, organic, different type of food, right? So sometimes there's that barrier of, how do we make them feel empowered to get out there and continue shopping and feel like they belong there, right? There's also the barrier of food insecurity. We've been working really closely with American Heart Association for they have funded us food insecurity screeners. So we provide $20 to each person who takes the food insecurity screener or survey at our farmers market. And the money is vouchers, so it's not cash; it's money through vouchers, and they can use it on locally grown food and locally sourced food at our farmers markets. So that's some of the barriers. Also, access to resources. We have tons of resources. We work with so many different partners in our community that sometimes it can be so overwhelming. We have our tables with our community health workers, working those tables, getting all these resources out to our participants. But sometimes in underserved communities, like transportation can be an issue. Are we working with the right partner to get to all of these nutrition education classes, or how can they get to the farmers market that isn't all the way in Forest Grove? And so we're just kind of facing some barriers there as well. I don't know if you wanted to add a little bit more, Dr.
Sure. I mean, again, we don't get a lot of what we're doing at Virginia Garcia is not compensated. This is a service to our patients, and it improves their health, it improves their lives. We absolutely support it. But again, the funding is coming directly to provide vegetables and fruit to the participants, which is amazing. But the funding to run the program, to keep the space open, to keep the garden open, there's nothing there. And so that challenge is pervasive. My patient care coordinator, Laura, who actually manages all the patients, she interviews each one of them, she maintains the wait list, she talks to them, she enrolls them, she works with them. There's no compensation for her time. And so when she does that, that's given by partially her, but also by Virginia Garcia, meaning that she's not attending to the other patients and the other tasks that she has on her to-do list, which is huge. So yeah, funding sources, and having a broad base. Like, I think every health plan should give every participant that they have some flex funds that would allow them to purchase healthy food and then to participate in the programs that we're offering. They need to help support the health center, the community-based health center. They need to help support community-based organizations. And I'm working on another grant right now, and I'll tell you, for the amount of money that we're getting and the amount of time that I have to spend to complete all these requirements and check boxes and make sure we're improving. And, you know, like Carla's talking about data collection. I mean, we have a data collection team, but again, focusing that team on this project costs money, and it means they're not doing other work. So please just reach out and donate generally, and know we're going to do good work because we have that reputation in the community. You understand what the program's doing, no strings attached. So.
Well, you're really producing a prevention program. You're really I've often heard the phrase food is medicine, and you are staving off problems later. And oftentimes it can be difficult for prevention programs to be funded. And there was a question in the chat about how you're funded and if there were transportation issues for the families. And I think that you did answer those questions. And also, Carla, can you just say how many participants are there served a year? Is it 10 families per year, or is it more than that? I think you said 50 people.
Yeah, currently 50. We have 50 participants, and that just continues to grow. So we have 50 participants, and they're scattered at different times because it depends on when they started. But each of those 50 families have 2 years to be in the program. Okay. And then we're hoping to expand to 80 this year, 2025.
I just wanted to toss in, it's 50 participant families, right? So that's clear. It's their whole family. So that's huge. It's not just 10 families or 10 individuals. It's gone from 10 individuals to 50 whole families. And those families range in size from three family members to 8.
Yeah.
So just understanding the reach of that. And all of those are community members. Most of those are patients at Virginia Garcia, but they don't have to be. You know, the one person in the family needs to be a patient at our clinic, and the whole family benefits. But getting to 80 participant families, and imagining the time that it takes to prepare the class, to set up, to break down, to get transportation for those individuals, to provide childcare, to provide a space. That means that our space at Virginia Garcia is not being used for other community activities because we're using the movement room, we're using our teaching kitchen, we're using the garden space. There's other meeting spaces. So a lot of the space we're donating to this amazing project, again, those have underlying costs. And so contributing to our organization earmarked for the produce prescription program, or earmarked to Adelante Mujeres to find a way to help fund these things, I think is really important.
And so your current partners really believe in you, your funding partners, and leveraging their belief in you and inspiration by what you're doing and all the amazing impacts. That's the message we want, right? We want other folks to hear the incredible impact you can make when you invest in a prevention program that has not just impact for the current family, but for generations to come, because those children are learning and being a part of the activities and the program. So thank you, Dr. Jacobs, for emphasizing that this is more than just the 50 people. It's probably, quadruple that at least, that are folks who are being impacted. And so I just wondered, what's your vision for the future? Like, if you had a magic wand and you could make it, I think we know some of it would be make the funding easier and more holistic. But what would be your vision for the future? And I know this wasn't a direct question we practiced, but I think that you both have this in your heart and soul, because the other questions we've already answered. So what would be your vision?
I mean, what I envisioned and what I see happening through this collaboration is that opportunity. I would like everybody to have the opportunity to participate in a program like this: access to fresh vegetables and fruit, access to education, access to a teaching kitchen. And what I love about Adelante Mujeres is their popular education emphasis, the way that the classes are taught by the people from the community, elevates the community, elevates the individuals, and empowers people. It's very different having my Reclamando Su Salud, where a doctor was sitting there with the participants, going through the same activities, going through the elimination diet, doing all the stuff. It was great, but it was very different. When the teaching comes from people within the community, it elevates them and it makes the information more relevant and more accessible. And so I want to see cooking classes happening all day long in our teaching kitchen, at least twice a day. I want to see it being taught by community health workers. I want to see chefs from guest chefs coming in from local restaurants at people's request. I want to see us be able to respond to what the community is asking for. One of the difficult things that we had when we were running our wellness center at full tilt prior to COVID was the childcare issue, and how to get past or overcome that barrier for patients or participants, because they do have small children and they do want to learn. And for an adult to learn and for a child to learn, we need kind of two separate spaces, and we need activities to be going on. But that funding also, that support has to be there. And so finding a way to make sure that children are in an environment where they can learn and participate, they can come together with the families, I think so important. And I have to say one thing that Carla was talking about, what they're doing this season or this year with their participants, is that the group decides we want to bring in our entire family. So the husbands are coming and they choose health topics that they want to hear about. And then they bring in doctors, either from our clinic or from OHSU or collaborating with community providers. Let's talk about the topics you want to know about. And we're really making that connection for people. And I want to see that kind of thing continue to happen and expand. And so we're hearing what the community wants. We're responding to it. We're making sure that those things are provided for them. I also want to see, I'm sorry, I could go on and on because there's so many things. I mean, I can just see, I would love this collaboration between what our wellness center is doing and what Adelante Mujeres is doing grow stronger, so that we can run trauma-informed groups. We can run groups for connectedness, to combat loneliness, for depression, places where people feel safe. And I think we've talked a little bit about the reputation that we have in the community. I don't know. I mean, COVID was really traumatizing, and it impacted our community. I mean, Cornelius saw the first case. We had the first patient be admitted to the hospital and die. So it is like within our community, these things are happening. And so to have a trusted place for them, for the community to come to receive information and to be honored is vital. And you can't just make that stuff up. So working to, I don't know, I mean, COVID was really traumatizing, and it impacted our community. I mean, Cornelius saw the first case. We had the first patient be admitted to the hospital and die. So it is like within our community, these things are happening. And so to have a trusted place for them, for the community to come to receive information and to be honored is vital. And you can't just make that stuff up. So enhance these collaborations and hear what the community has to say, provide the services that they want, and expand what they receive.
I love your passion, Dr. Jacobs. And I so agree with you. When you feel like you belong and you're heard and seen, you feel safe, and then you can flourish.
Yeah, exactly. Exactly.
Carla, how about you? What's your vision? What do you hope?
Well, I love Dr. Lynn's passion too, and I think I share that exact passion. And this is why we work so well together. I have like a long list of what I see in the future, but it definitely connects to everything that Dr. Lynn just said. I think that I didn't mention, I love that you reminded me, is like how important it is to have community health workers leading these groups. The community health workers at Adelante Mujeres are definitely the heart of this program. They facilitate, they prepare, they get the community together, they get our participants to come to every single class, the text messages, the reminders, they really help them. So it's just so important. I cannot forget about how crucial they are for this type of program to work. But so with that said, we need more. We need more. And so we need more funding to hire more community health workers. We also, I do see that with like situations like the food screeners that we're working with, that project with American Heart Association, we're actually seeing a lot of people who are food insecure. So they are part of some of them are part of our produce prescription, but some of them aren't. They're just in the community. And so our case management level has increased, right, for the community health workers. So a lot more cases coming in for people who need this support. So then another thing that I think is super important is, and I hadn't mentioned before, is, well, I mentioned a little bit, but the data. So we're working also with American Heart Association on blood pressure monitors. So they provided us with about 25 blood pressure monitors, and we are monitoring all of our participants every single time they come into class. So something that Dr. Lynn and I and the team and our teams have talked about is how do we get that information, that data into their system, into their EMR system, and then how do we get that information out without releasing any information that, we need to have everything HIPAA informed and everything, right? So that's super important. Then also the expansion of our program is also something very important, is that we actually received funds from Care Oregon to launch our first child nutrition pilot. It's called Healthy Futures, and we launched it last year in November, and it's going on for a year and a half. And it's pretty amazing because it's working with children from 0 to 5 with their parents. And so you're seeing how are we going to prevent them from getting to become a patient of Virginia Garcia at 10 years old with prediabetes, right? So that's a really powerful opportunity, but we need more pilots like that. We need more funding like that. Also, working with the local farms is just so important to both of us, to Virginia Garcia and to Adelante Mujeres. We do not want to give up on that small community. Like, let's all work together. And so building that connection with our local farms and local stores is super important to us and to the families. And like I said, it's only from May to October, and we don't want them to lose that, like the local, how important local business is, right? And the bigger organizations or the bigger companies like Walmart and they don't provide that extra love to the fruits and vegetables as smaller companies do, and small businesses. And another thing that I think is two more things I want to mention, and then I will stop talking, is evaluation. We want to show the impact of these. We know that it's impactful. We hear the testimonies, we see the numbers, but we need to show it to everyone. We need to show our funders, we need to show our directors, we need to show other people. So it would be amazing to have an opportunity to work with another third party to get these surveys and this data properly organized, right? And a good, strong manual. And then one thing that is so important, and then I wanted to also answer the question that you had said in the chat, is that we are building partnerships every single day with different organizations. And so we actually work with TriMet here in Oregon, and we just recently got contracted. All of our CHWs can now enroll community members in a discounted program called HOP, where they get to have very, very discounted amount of for the bus and the metro system. So we have to continue these partnerships. Like Dr. Lynn had mentioned, the OHSU doctors. We need to connect to more doctors. They don't always need to be in our program, but it's nice to have them come and step by so we can break that barrier between doctor and patient, and we just are in community.
A few things that you mentioned. I think as far as the electronic medical record goes, we're going to be piloting this program where because my patient care assistant is at every session, at least at the start of every group visit, she's going to be opening an encounter so that she can document their blood pressure and their weight if they want to have that kind of thing documented, and help us because we also are trying to demonstrate and meet our metrics, which are far and wide. It's diabetes control, it's depression screening, et cetera, et cetera. But because my patient care coordinator is there, she can talk with patients, she can help them get access to their clinician, to their clinician's team, so that they can get the care that they need. And I think really kind of joining those things together and knitting that more firmly will really help them, help the participants to feel more connected to our clinic and more connected to the care that they need to manage their diabetes or manage their hypertension. And as far as getting new children in, we're open. We're open for new children, absolutely, and that should be a direct line. It should be like there's a wait list, but we're welcoming 4 new patients per clinician a day. So we're, in Cornelius, we're wide open to new patients, and this is exactly the community that we were created to serve. So, and I think having the ability to speak to people in their native language has always been a top priority of Virginia Garcia, and most of our clinicians are bilingual, and if they are not, they have access to high quality translation. But our goal is to have the care being brought to the patient in the language that they speak. And so that's another aspect.
It's really clear that your passion and belief in this program, and then the outcome and impact you're witnessing, just really is the engine that drives you past these barriers. It's almost like you see a barrier and you're like, okay, well, how do we get around that? Okay, all right, how do we eliminate that? And I'm just, as a colleague in the community, I'm just grateful that you keep on going and you don't give up. So thank you for that. And I'm wondering, are there other produce prescription programs in the country, or are we it? Are you all it?
No, there's a lot. We actually work with 11 other produce prescription organizations within Oregon. And so we're part of a food network system, and I can send the information. And I believe there's about 11 of us here in the state of Oregon, but they're all over the place. And we actually recently went to Washington, D.C. and connected with a lot more produce prescription organizations on the East Coast, and learned a lot more about food as medicine and how we're incorporating that into our program. But I will say that things are going to change in 2025. That's my honest belief. And if anyone wants to learn more about produce prescriptions, I would highly recommend reading a little bit more about the 1115 waiver in Oregon, because in 2022, when the White House had the conference on hunger and nutrition, that just sparked the importance, how important nutrition is for the United States. So this is all nationwide, right? Not just in Oregon. And so in January of 2025, so this coming in a few months, this is going to be the opportunity where a lot of funding is going to come in for nutrition programs like this, and also capacity building, and how can we build to Medicaid and Medicare. So there's going to be a big shift, and I'm just excited to be a part of it and excited to see what's going to happen. But wow, amazing, that the White House took this into consideration, how important nutrition is, and how the United States and the Americans are not doing very well compared to other countries when it comes to diet-related diseases. So I'm looking forward to that. I'm looking forward to January.
Well, thank you. I was going to follow up and ask you, why are you so excited about 2025, Carla? And thank you for sharing. It's because there's going to be legislation that'll help fund and perhaps remove some of the barriers that all of you have had to navigate for many years. It's not only the systemic barriers, but it's also the folks, making sure that they want to go to the farmers market and that they want to come to the classes. And you have all, Dr. Jacobs, you said repeatedly, it's about that community trust. And that does not come easy. And obviously, you have all built that beautifully in the community. So folks come to you. So we're so grateful for you. So before we let you all go and say goodbye, this has been a delightful and informative and passionate discussion about the importance of nutrition and community-led efforts. And we're so grateful that Virginia Garcia Memorial Health Clinic and Adelante Mujeres is doing this work, and we honor you. And we're grateful to be a partner with the American Heart Association. As the president of the board, I'm very thrilled that you're working with us. So thank you. All right, my last question of the day is, what would you tell somebody if they wanted to start a produce prescription program? What would be the top 3 things you tell them they need to do?
Okay, I guess I'll start. One, I think it's, because I'm a program manager, it's build your team. So you have your community health workers, you have your coordinator, and you're all together working on something that you believe in. You really do have to believe in this, right? Another thing would be partner with everyone and anyone that you possibly can, because people who also have the same passion that you do and believe in nutrition and believe that food is medicine, they will support you in any way they can. And it might not happen tomorrow, but it could happen in a few years. So I highly recommend partnering. And then very, very important as well is know your community's needs, because we're talking today about the Latina community, right? But every community is different and they have all kinds of needs and all kinds of different things. And we're very fortunate to work with Virginia Garcia and all the programs at Adelante Mujeres, because we have these wraparound services. But really, before you start a program, you need to know what your community is looking for and what barriers they face, and also how you're going to build this curriculum around their needs and their barriers, and also your passion and your mission and everything. So those are the three top things that come to my head.
Thank you so much, Carla. Go ahead, Dr. Jacobs.
I would say, I think that the fundamental relationship between Virginia Garcia and Adelante Mujeres is foundational. I don't think, Carla came to this program and you've done amazing things over the last 2.5 years. But if we hadn't had the foundation between the two organizations, the trust between the two organizations that were mutually respected within the community, I think it would have been harder to get participants and space and the access to the connection between their health care and their physical and emotional health provided by the produce prescription program. So I'll just say, I think if you're going to start a program like this and you want to have it connect to the healthcare system, you need that partnership to be solid. And so as you're exploring what the community's needs are, you need to partner with, and I would say an FQHC. You could partner with someone in private insurance. That might work for you're just going to have a different population. At a federally qualified health center, you know that the people that come here are the most in need in the community. And so you've got a ready population that is in need. And so to me, providing a produce prescription to a community that you know has limited access is vital. And so that connection to a community health center, I think is really important.
Thank you, Dr. Jacobs. And thank you, Carla, it has been an honor to be with you both today and to see how much work you have done and your innovation that you have done to make sure that the Protis prescription program exists here in the metro region. So grateful to you. And I love how you're constantly thinking about how do we make it better? How do we make it better? So thank you so much for sharing today and spending your time with us and for what you do every single day to take good care of Oregonians here in our community. And I hope that we don't have any more questions in the chat, but I hope that those who've been here today have found some information that's been helpful and inspiring to all of you. Meredith?
Well, I feel the passion and I'm excited on this Thursday morning. And I just really, the work you all are doing is so important. And coming from the American Heart Association, food really is medicine. And we are just so thankful for the work that we're doing with you all and excited to see where it can go. So I'm feeling the passion today. And just a really big thank you, Dr. Schubert, for moderating, Carla and Dr. Jacobs, just for sharing really the work that you're doing. And I hope you all really took some great takeaways. And again, if there were any questions that were asked in the chat or in the Q&A that we didn't get to, we will answer them in a follow-up email. A big thank you to Cambia Health Foundation for sponsoring this webinar today. And lastly, thank you to the audience and for all of you for listening with open ears and contributing to the conversation and tuning in.